it comes to the mobility requirements for a squat, I'd say number one is ankle mobility. Nothing can wreck a squat faster than poor ankle mobility. And number two is the hip mobility. So if you look at this hip joint, obviously we don't have the femurs attached, but you can see that socket. The hip is a ball and socket joint. It's designed for movement. Specifically, we need it to be able to rotate internally and externally to take stress off the lumbar spine. So our hip mobility exercises are really going to be focused on hip rotation, because otherwise flexion and extension don't really become too limited as long as we can kind of find that groove to be able to sit into. So our hip mobility exercises, we're going to focus on rotation. We have a ball and socket joint. We want to make sure that your hips can rotate. A really good place to start for hip rotation, to kind of stretch out the lumbar spine, the low back, and really start to groove some rotation into the hip, is called hip switches. So you're going to find a place, you're going to lay flat on your back, and all you're going to do is you're just going to let that go side to side. So feel that stretch on your lower back, try to get that knee to the ground, and then rotate the other way. Just back and forth. Nice and easy, slow and controlled. That's called a hip switch. Another hip exercise I really like is going to be a supine or on your back figure 4 stretch. So you're going to lay on your back, you're going to bring one heel over one knee, and then you're going to lift up. And all you're going to do is you're going to reach through, grab that opposite thigh, pull towards your chest, and relax. So this targets the hip external rotators, which a lot of times those become pretty tight through training, too much sitting, lack of use. We're able to stretch that. You should feel a stretch kind of in that back pocket and kind of in through that hamstring area. So you're going to want to do this on both sides. Whatever leg is bent is the side, the hip that you're stretching. So supine, external rotator stretch, figure 4. Our next movement is going to be an all-4 position, and you're really going to focus on gliding your hips into different rotation. Now you want to limit the amount of movement that you get in your lower back. So it's important to be able to pressurize your abdominal wall, kind of breathe into your belly and hold that tension while you do the movement. Okay, so what it looks like is you're going to get on all 4s. You're going to take a deep breath into your belly, kind of pressurize that abdominal wall, that canister. You're going to bring one leg up, and then you're going to open it up, like throwing your knee out, like kind of this yoga pose, this dog. Out, and then from there, you're going to rotate your heel up towards the sky. You're going to drive some internal rotation, and then back. Okay, so how that looks again, deep breath into your belly. I recommend you kind of breathe every single time. Deep breath in, trap that air, up, out, rotate, and around. Okay, so you want to do that on both sides. Deep breath in, out, rotate, and around. Trying to limit the amount of bend and strain that you get in your lower back. You should not feel this in your lower back. You should feel it kind of in that hips as you drive rotation. Another really good hip stretch is going to be the pigeon pose. How I like to do that is you're going to get in this position, kind of right foot forward, left foot back. We're putting a good amount of hip extension into that backside. We're going to focus on driving our knee up and kind of getting in underneath of that with our pelvis. Just kind of hold that for a few. You can sink down into it and really relax and breathe into your belly and feel that stretch. And then what I like to do is like upright yourself. You're going to focus on kind of driving that knee in, pushing in, and then actively kind of sitting back into it. Up, down, up. So it makes it a little bit more active, kind of stretching into that hip, kind of clearing out some rotational issues. You're going to want to do that on both sides. Sit in here, up, down. Sink into it, really kind of focus on breathing into your belly, getting comfortable with being uncomfortable in that stretch. Hold for a few, and then kind of come up and back down, up and back down. So pigeon stretch. So we're going to finish with a shin box or a figure 4 90-90 switch, so it's kind of like the hip switch, but it gets into a little bit more uprighting of your spine, so it becomes a little bit more difficult. So how this looks, remember with the hip switch we were laid back, how this one looks is we're here, and we're going to go down and stay tall through your spine, bring your chest over your knee. You should feel a pretty intense stretch in your thigh and your hip. And then you're going to rotate back this way. So here we're really driving internal rotation. As I rotate my spine and pelvis back over my leg, which is stationary and stable, I should feel somewhat of a little bit of a pinch or a stretch on this front of that hip there. You don't have to hold it for a long time. If you have any sort of impingement, I would avoid this. But what you can do is you can kind of drive that in, kind of internal rotation, and then back the other way. So you're just going to make it pretty active and dynamic. Hold for a few. It needs to be uncomfortable for you to kind of get through the appropriate tissues, but we don't ever want to hold it for too long. So then from here, we want to switch to the other side. Same thing, so now we're doing external rotation here, internal rotation here, kind of feeling that back both ways. Making this dynamic, I just spent a couple minutes on each side. And then if you really want to start to drive internal rotation, is you can come back here and then you're trying to lift that up like this. You can actually help yourself. You can prop it up with a box or a yoga block and then see if you can actively, if you help yourself, can you hold it? Like that's the really big challenge for mobility, is being able to maintain that. Come back the other way. So that's the Shin Box, or the 90-90 drill, to kind of finish out and really drive in hip rotation to kind of take stress off the lumbar spine and move through that ball and socket joint like we're doing.